So there's a special exam I'm going to be doing, which is the patient's favorite. It's a jaw exam. What did you think of this? All right, well, I never thought as a chiropractor I'd be looking into people's mouths, but actually it comes up a lot because a lot of people have TMJ problems, jaw problems. They're super common. I'm not exactly sure why. I even have them myself. I sometimes wonder if they're related to having braces and having my teeth and jaw moved. But I'm gonna show you how chiropractors can deal with TMJ, jaw pain, jaw clicking, which again is unfortunately pretty common. So looking at our patient today, we're going to start with looking at her range of motion. How does her lower jaw or mandible move in relation to the upper part? So what I'm going to have you do is, and I'm going to be feeling the joints on the side when she does this. Can you open your mouth all the way? So come on back closed. Now, I'm getting a lot of information this I'm going to try to talk you through. We're looking at a couple of things. One, how wide she can actually open, how much space there is. The second thing we're looking for is deviation of the mandible to one side or the other. So can you do that again and do it really slowly, please? Okay, so when our patient opens and slowly close, you can see that this lower part, basically if we're looking at the chin, do that again, open slowly. Yeah, and it just kind of goes down and deviates over to the left a little bit as she opens. So she doesn't have, and you can close, doesn't have perfectly symmetrical opening. That can often indicate a tight or affected TMJ joint capsule on the same side as her jaw is tracking to, which in this case is the left side. Now, if you open again for me, and when she does her opening, what I feel on the right side is the upper part of the jawbone just kind of popping over and out on this side. So very often in people who have a tight joint capsule on one side and the jaw shifts to that side, will actually have more symptoms in terms of discomfort and clicking and pain on the other side, in this case her right side, the side that her jaw is moving away from. Now, as we ask our patient here, so do you have some jaw symptoms?
I do have tight jaw.
Tight?
Because I clench at night.
Okay, and you feel it on both sides?
Yeah.
Okay, so now as I palpate both sides and the muscles on both sides, we're gonna see what she feels. That's gonna give us some more important information. So, is that tender? Okay, these are the masseter muscles, the big chewing muscles on the side of the face. We also have muscles up here called the temporalis, which contribute to chewing. Any tenderness there? Not much, right?
Not much, just a little bit.
Okay, and then if I get into the actual joint, is that tender? Not too bad, right?
Too bad.
Okay, doesn't really feel swollen or anything. Let's try the other side. What do you feel there?
It's
more tender, right? And the muscle here has a very ropey, tight feel. Feels different than the left side. So these muscles they're either overworking or they're getting overstretched as her jaw gets pulled over to the left. And that's probably got to be a bit tender, right? Mm-hmm. So really interesting, and again, a typical TMJ case. Jaw deviates to one side. The side that it deviates away from has tighter muscles, more irritated joint capsule, even though this joint capsule is tighter on this side. So I'm going to do some work on the muscles and an adjustment, and then I'm going to give her some exercises. Basically, it's a stretch like yawning that she can do every day to help open up the space in this left side joint capsule to help give her some long-term relief and correction. I'm taking a contact on these right-sided muscles here, and I'm going to have you open slowly. As far as you can. Okay, and close. And open. And you see her really pulling over to the left. And close. And open. and close. And we're going to do a little work on the left side too. So let's have you open. Good. And open. And one more time. Yeah, I know that's painful, but that's good. Okay, we can do a little bit of motion at this joint here. You're going to turn your head this way. You're going to let your teeth separate a little bit. You're going to let your teeth separate a little bit. Good. So there's a special exam I'm going to be doing, which is a patient's favorite. It's a jaw exam. What did you think it was? So another thing we can do to help is a mobilization of the jaw. Again, we want to get this left joint capsule moving better. So for this, I'm going to go into the mouth and have you open for me. I'm going to come in and grab the mandible. And I'm trying to kind of pull the left side. You can see my hand moving, and I'm trying to gap the TMJ, or the joint space, on that left side. And this actually, it might look uncomfortable, it actually can feel really good. And it does, doesn't it? And it's a really nice way to create some space there. It can give a lot of relief from clenching and tight jaw muscles. And then one more technique we can use in the mouth is to do some trigger point work on the pterygoid muscles, which we can access inside. So we're gonna have our patient open up, and I'm gonna come in here and I'm gonna press, and we might see her eyes start to water because this is often tender, a little tender there. People who have TMJ problems. So we would just hold that for a little bit, work on that muscle, and just, I won't keep doing that to you, but for comparison's sake, let's feel the right side. More tender. Okay. So that kind of fits with our exam where we found the right-sided outer jaw muscles, masseter, more tender on the right side. The inner jaw muscles are more tender on the right side. I won't keep doing that to you. But again, the real thing that we want to address is the tight joint capsule on this side, so that when she opens, her jaw tracks normally. It doesn't pull to the left, which doesn't overstretch the right-sided muscles, which ultimately long-term are going to give her relief. Okay, so if you're having jaw TMJ problems, chiropractic can be very beneficial. Of course, if you're having any dental issues, see your dentist, see your orthodontist, get them to check you, find out if you have any infections or things that a dental professional needs to deal with. But once they've done that and the TMJ problems are persisting, chiropractic can help you. All right, so if you enjoyed this video, be sure to like and subscribe. We have more great content coming your way. And if you want to come to see me, find out how to get a hold of me in the links below, and even come to my office and have the Dr. Pete Chiropractic experience. Thanks for watching. We'll see you in the next video.